Hi there, I'm Antonio. I'm one of the podiatrists here at the Foot Clinic, and today we're going to talk about a condition that people probably hear a lot about but probably don't know too much about, and that is gout. So gout commonly occurs at the first metatarsophalangeal joint, also known as your big toe joint. When you have a gout attack, it typically presents as a really painful, swollen, red and tender area, and that pain can be really excruciating to the point where people aren't able to sleep, and any real movement or touching at this joint can cause severe pain. So what actually is gout? So gout is a form of inflammatory arthritis that people get in their big toe joint, and it occurs there because uric acid crystals accumulate there, leading to an inflammatory response from our body. When our body really has that inflammatory response, we get pain, swelling, redness at the site. So people who have a high level of uric acid are more predisposed to getting a gout attack, and people can have a high level of uric acid purely due to genetics, also due to their diet, typically diets that have a lot of meat, shellfish and seafood, or high alcohol content, as well as numerous other lifestyle factors that can affect the levels. Now, if you suspect that you may have gout, you're getting these sort of symptoms with a lot of pain, redness and swelling at your big toe joint, it's important to seek professional opinion as soon as possible, so we can ensure that we get you on medications early to reduce that pain, swelling and redness and stop any damage happening to the joint. The good news is that there are lots of treatment options available in the short and long term to make sure that we get you moving and back to normal as soon as possible and stop it happening more in the future. So in the short term, our treatment goal is obviously to reduce your pain, swelling and redness that you're feeling. This is typically through medications such as high-dose anti-inflammatories or similar, and also just a period of rest for 3 to 5 days to allow the inflammatory response to reduce. Then after that 3 to 5 day period, then we look into the long term and see how can we firstly keep your uric acid levels lower, and secondly ensure no damage has happened at the joint. So firstly, with keeping our uric acid levels lower, that's through dietary changes, longer term medications and also just some lifestyle modifications. And then in terms of conserving the joint, we need to check through imaging, see if any damage has occurred at the joint, and if so, just take some appropriate measures to make sure that this damage doesn't get any worse in the future and you're able to function as well as possible. So if you ever experience the symptoms of gout, or you've had gout in the past and you're still getting some pain in your big toe joint, don't hesitate to call us or book online, and we'll be able to tailor a treatment process for you and your needs and keep you on your feet, keep you moving and keep you active. So yeah, thanks for listening.